Menstruation is actually the periodic shedding of the endometrium lining, that is blood and mucus, through the vagina every month cyclically in the females. Menstruation occurs because of withdrawal of the progesterone hormones. Actually, the uterus lining, which we call is the endometrial lining, is under the control of estrogen and progesterone, which are secreted by the ovaries. So the first 14 days, there is a little high level of estrogen, and then there is a sudden peak of the LH hormone that is secreted by the pituitary, and then its sudden withdrawal causes a drop in the progesterone level, and this results into shedding of the endometrium in the after next 14 days. So it is actually a progesterone withdrawal effect on the endometrium, which leads to shedding of the endometrium in the form of menstrual blood. The age at which the menstruation first occurs has been changing off lately. This age is known as, this period is known as actually menarche, when the girl first has the periods. Now, initially, long back, around 20-25 years back, it was around 11 to 12 years of age when the girls first used to have menstruation. But now in our OPD these days, because of some certain lifestyle changes, some hormonal changes, even the girls who are of 9 years of age or 10 years of age, they are also coming with menarche and menstruation. So not a fixed age of menarche. It may be 9 years or not, but commonly it is between 11 to 13 years of age. The bleeding differs from patient to patient. It may be between 3 to 7 to 8 days. Age-wise, it's different because in early periods, early girls, early childhood, like adolescent girls, what happens, the periods are not very regular. Sometimes they come after 1 to 2 months and they even last for 10 to 15 days. But as her ovarian, hypothalamic, ovarian, and the uterine axis is established, then the periods start coming more regularly. Maybe around 28 to 34 days they have their cycles, and the bleeding is between 4 to 8 days. And when the lady is in her perimenopausal phase, then in that time again the side, because of the diminishing in the AMH hormone and the LH FSH rising up, they face more or less irregular cycles, scanty ones, and gradually the irregularity increases and they land up into menopause. Menstrual hygiene itself is very important, and it prevents and protects the girls from so many diseases of the vulva, vagina, and is very important that these girls should maintain menstrual hygiene. Still, in many parts of India, the women do use cotton clothes. Some of them, they even use the old saris and bed covers because of the poverty issues. But the very important is that whatever you are using, whether it is a cotton cloth or it is a sanitary napkin or a tampon, or nowadays the girls are using Cialis cups. The important thing is that everything should be neat and clean and frequently changed. They should not just keep on wearing the same pad right from morning till the night. At least changing of pad 3 to 4 times in a day is required, and it also varies depending upon the amount of flow that you're having. Like on the second day, the flow is very heavy, so you might have to change around 4 times also. But then on the first and the third and the fourth day, as the flow decreases, then the number of pads or the cloth changing can be reduced. But then you should be every girl is aware of her menstruation pattern, her menstrual bleeding pattern, and she should be very particular about the hygiene part. And of course, the proper disposal also is required. Menstruation pattern is, as I told you, it differs at different age group. In adolescence, puberty, it's something else. Around the regular cycles are something else, and then in perimenopausal, they are something else. But every girl is aware of her menstruation pattern. Now, if a girl who is having regular cycles of 20, 30 days, if she is missing her periods and it is around 1.5 or 2 months, then she should consult the gynecologist, because it may be some sort of hormonal problems that she has started developing inside, and this needs to be taken care of. Of course, in the childbearing woman, if she is missing her periods, she should undergo a self-pregnancy test, and if at all it's showing pregnancy, whether she wants to continue or she doesn't want to continue, it is her own opinion and wish. But then, of course, gynecologists need to be consulted and accordingly plan what has to be done. But I think that for a regular cycle person, if missing of period is there, definitely they should consult the gynecologist.